Hello everybody, and now I'm going to discuss with you what is called as enlargement of prostate, very commonly called as benign enlargement of prostate. So these are the symptoms which are faced by men as age advances. The testosterone levels go slightly low and there is increase in the size of prostate. So prostate is one tissue which lies between the bladder and the passage of urine. So it is like a donut which has an opening in between. So as the prostate enlarges, the opening becomes smaller and smaller, and as a result of which what actually happens is there is an obstruction to the flow of urine. Many a times it is just a natural phenomena. Normal size of prostate is 18 grams and it can increase to almost 20-30. We see patients who have a prostate size of 200 grams. Actually, in prostate the size does not matter. What matters is the symptoms that the patient has. The common symptoms that the patient start perceiving is he has difficulty in passing urine. He has to strain to pass urine. Initially, if the flow used to go far, now the flow is much slower and it starts falling towards the leg. They sometimes feel they have not passed the complete urine, so there is a frequency you have to go to urine again and again. One important symptom which is also seen in prostatic enlargement is increase in the time you are getting up at night to pass urine. Patients can have symptoms like recurrent urinary tract infections. A man should never have a single episode of urine infection in his lifetime. A urine infection actually means that there is some obstruction. So all these are symptoms of prostatic enlargement. There are other differentials, but here I am discussing purely prostatic enlargement. You should visit a urologist. They'll examine you. They will do a test which is called as an AUS symptom score, or it's a questionnaire which is based on the patient, where we assess 7 important factors and which decides what treatment the patient needs. It's a simple disease. It's a life-changing treatment is by a simple medicine called as tamsulosin. It's a kind of an alpha blocker category of pharmacological agent. And what it does, it relaxes the prostate capsule, it decreases the obstruction and increases the flow of urine. Those patients who are getting infections, who perceive severe obstruction, or there is a blockage where they have to pass a catheter inside, or they start developing stones, or by any chance the obstruction is so severe that there is damage to the kidney, these are few categories of patients where we need to do surgery. If the patient's symptoms don't improve in spite of alpha blockers for a long period of time, then also a surgery is merited. Surgery is very simple. It is like increasing the channel of the urine passage. It can be done by various ways. The best way in the world today is a bipolar TURP. Some people do use holmium laser and thulium laser, but laser is mainly for those who are anticoagulant or antiplatelet drugs which you cannot stop. So the simplest treatment is you should visit a urologist, get yourself examined. We do a blood test called as a PSA, which assesses the risk of prostate cancer, and then start yourself on alpha blocker and all these symptoms decrease. The alpha blockers technically has to be taken for a longer time, for most 3 to 6 months, or occasionally even beyond that. So if you have any of these symptoms, guys, do visit a urologist and seek help, because passing a normal urine is very essential to having a healthy life. Thank you so much.